When it comes to health of natural teeth or dental implants, the gum tissue plays a very important role. The gingival architecture and health directly promotes the aesthetics, our smile, as well as protecting the underlying bone and teeth. But what does exactly a healthy gum tissue mean? What are attached and unattached gingiva? And what are the various biotypes? And what are the characteristics of a healthy gum tissue? Today, our talk is all about gum tissue, what it is, how it works, and how it keeps teeth and dental implants healthy. I'm Dr. Ryan Kazemi, and welcome to Hints and Tips in Dentistry. One of the most important factors in keeping our teeth and dental implants healthy is the gum tissue. The gum tissue, or gingiva, makes a huge impact on our smile, on our aesthetics, our lip line, how much gum tissue we show, the thickness and health of the gum tissue itself, and also the presence of the papilla, which is the tissue that forms between the teeth, all impact our smile line and aesthetics. The gum tissue is also very important in preservation of the health around our teeth. The healthier and thicker the gum tissue, the better and healthier the underlying bone and teeth in long term. So it's important to understand what gum tissue is and what are its characteristics. From an anatomical standpoint, we basically have two types of gum tissue. The first one is known as attached gingiva or keratinized gingiva. This is a type of a gum tissue that we have around our teeth. It's fixed, it does not move, and it forms our gingival line and the papilla around each teeth. The second type of gum tissue is known as unattached gingiva. This is the movable, more loose type of a gum tissue that is positioned above the attached gingiva, and they're separated by what is known as the mucogingival junction. We also have two tissue biotypes. The first is known as the thin tissue biotype, in which case the gum tissue itself is quite thin. We see this quite characteristically in people who have triangular, longer teeth with scallop-looking gum tissue. And thick tissue biotype, where the gum tissue is thicker. And we see these characteristically in people who have more of a square-shaped teeth, and the gum tissue itself has more of a flat appearance to it, as opposed to the scallop appearance in the thin tissue biotype. So the question is, what is a problematic gingiva? We consider these factors to be contributing factors to a problematic gingiva. Having unattached gum tissue around teeth, ones that are very thin, gum tissue that bleeds, whether from brushing or flossing or doing dental exam, and also gum tissue that has developed deep pockets, which may indicate the development of periodontitis or gum disease, also known as periodontal disease. Because all of these factors can lead to irritation, inflammatory process, gum tissue recession, certainly bone loss, and tooth loss if not treated. So what is a healthy gum tissue? What is a healthy gingiva? A healthy gingiva is characterized by having an adequate amount of attached gingiva around teeth, the ones that are of thick tissue biotype. They don't bleed, and also they have shallow pockets around them. Let's take a look at a thick and attached gingiva. Here's a patient. As we discussed, the thick and attached gingiva has a type of a quality that does not move around teeth, and it is thicker and more abundant, both around teeth as well as implants. And the role of an attached gingiva is really to provide almost like a tight belt, like a sealing effect around teeth and dental implants, and this is very important in the longevity and health of both teeth and implants. They're also very important around dental implants. We know that if dental implants lack this thick and attached gingiva, they can be prone to inflammatory process. Here's an example of a patient that has no attached gingiva around the dental implant. This can lead to peri-implantitis, which is an inflammatory process that develops, eventually leading to bone loss as well as compromise in the health of the implant. So if we have dental implants that have no attached gingiva, the prognosis can become compromised. So what we can do is perform a gingival graft to develop this thick and attached gingiva around implants. And here's an example of this patient where we were able to develop a nice, thick, and high quality of gum tissue around this implant and restoration, and this adds to the longevity of the teeth. And in patients who have dental implants with perhaps a very thin zone of this attached or keratinized gingiva, we can perform soft tissue grafts. We can develop a higher quality and a thicker gum tissue. And this will lead to a number of advantages, a number of benefits. Having a thicker gum tissue leads to a healthier bone and actually preserving the bone for longer term. A more stable implant, better aesthetics, easier to clean, and ultimately a better implant longevity. So it's important that we take every measure to develop this type of thick gum tissue and attached gingiva around dental implants for long-term success. In patients who have thin gingiva with gum tissue recession, this zone of keratinized gingiva diminishes and can eventually become non-existent. As we talked about earlier, this can lead to development of further tissue loss and bone loss and gum disease. So what we can do is perform a gingival graft to essentially develop a thicker and higher quality gum tissue around teeth, and also take care of the recession, which is an unaesthetic outcome of it. So a healthy gingiva is characterized by attached gingiva around teeth, one that is of thick tissue bioform. It does not bleed and has a very shallow pocket, indicating a healthy gum tissue. The other factor that we looked at in terms of a healthy gum tissue is having non-bleeding shallow pockets around the gum tissue. We know that when we have a healthy gum tissue, the depth of the gum tissue should be no more than 2 to 3 millimeters in depth. So when we approach 5 millimeter, 6 millimeter, or more in the depth, it indicates presence of gum disease, periodontal disease, which can ultimately compromise the health of the underlying bone and teeth. So it's important that we prevent and treat early gum disease. So if we notice bleeding gum tissue or pockets, they should be managed. And this is done through professional and home care regimen before it becomes a more advanced periodontal disease, which will compromise the health of the tooth in long term. So here are my tips on how to optimize gum tissue for better health and longevity around natural teeth as well as dental implants. First, important to have an optimal and meticulous oral hygiene care in order to prevent gingivitis or periodontal disease. Second, to develop attached gingiva around teeth and implants, as well as develop the thick gingiva tissue bioform around both implants as well as teeth. And when they're inadequate, to use various soft tissue graft techniques to improve the quality and quantity of that gum tissue or gingiva around dental implants and teeth. A healthy and abundant gingiva plays a critical role in keeping natural teeth and dental implants healthy. So when gingiva is deficient, a gum tissue graft can restore its quality and quantity. And this is particularly important and often necessary when we replace missing teeth with dental implants. And that's because there's a natural tendency of the gum tissue to shrink and lose its zone of attachment. It's a relatively simple procedure, and it can make a difference between a mediocre result and those that are remarkable and long-lasting. Remember, thicker gingiva with more attached zone are the key to the long-term health of your teeth. I'm Dr. Ryan Kazemi, and see you again soon on the next Hints and Tips in Dentistry.